Welcome to the Alliance Connection, a podcast by the Greater Fort Dodge Growth Alliance. Each week, we bring you insights on business, economic development, and community growth in the Greater Fort Dodge region. Our focus is to drive progress, support local businesses, and enhance the quality of life in our area. All right, welcome, and thank you so much for joining us on the Alliance Connection today. I'm Astra.
And I'm Katie.
And today we have a guest with us, Leah Glasgo. Welcome.
Thank you so much for having me. I'm really excited to be able to share some of really just exciting things happening at UnityPoint Fort Dodge.
Absolutely. There's so much cool things happening, and I cannot wait to get into that. But first, make sure that you are checking out all of the cool things in the whole entire community, because we have exciting events happening. We have our golf outing coming up. That's September 4th. We have our Country Jam happening with Trace Adkins, none other. Right?
And that's downtown, right?
Oh, yeah. Downtown Country Jam. Tons of volunteers that make that amazing. All that just enhance the quality of place and quality of life right here in Fort Dodge and Webster County. But what else are we wanting to make sure all of our listeners check out, Katie?
So we have Purina celebrating 50 years here in Fort Dodge. Wow. They're having a big get together out at Community Orchard. Yes. That's going to be on August 30th from 11 to 4.
That's amazing.
Yeah.
That's amazing. And yeah, they have been just such a major employer for a long time, and then celebrating 50 years. That's fun.
Amazing.
That is so cool.
I know.
So that'll be a great time. Yeah. And then also with the business connection, there's some exciting things that our readers can see and we can check out online even about Iowa Central has a lot of things going on.
They had over 30 people retire this semester.
Oh my goodness.
And so there's a feature on them in there on top of, we had Iowa Central as our board member spotlight.
Absolutely.
And so we have Dr. Jesse Ulrich answering some questions and just giving us the lowdown.
Awesome. And we also have our board member spotlight. You said Iowa Central.
Yep.
And then on the cover, we had Frontier Days Parade Grand Marshals.
Yes. Charlene Washington and Judge Brown.
Yeah.
We got to sit down with them and do our Q&A.
Was that just amazing?
Literally, their stories were so inspiring.
Awesome.
Like, the life that they have lived.
Like 100 lives.
Literally.
Ugh.
And Charlene's on the silo. The big green silo.
She's basically like Fort Dodge, Webster County famous.
Yes.
Quite literally. Yes. And
So
if you saw the things that she's done for our community, you'd know why she's on the front of the silo.
Absolutely. So do not forget to check out that interview with them. That'll be great in the business connection. But we have such amazing people in this community, I feel like. So without further ado, there's also some very exciting things happening right here at UnityPoint Health. Leah, welcome.
Yes. Well, thank you. Thank you for letting me be here. Really excited to get to talk to you both about what's happening.
Yes. And you have been the leader here for some time. Tell us a little bit about your leadership here and how that's been.
Yeah. Well, thank you for asking. So first of all, I mean, just to what you said earlier, so many amazing things about this community. And so that's really what drew us to Fort Dodge, the opportunity to serve our community. I'm a hometown, I'll say I'm an Iowa girl. I didn't grow up here in Fort Dodge, but I was raised in Iowa. And so spent my whole career in rural hospitals. So my passion really is getting services right here to our community and just elevating the level of care that we're able to serve right here in Fort Dodge.
That's awesome. And you guys are definitely a major employer. How many people do you employ in our community?
Yeah, we employ just over 1,000, I would say, team members, a lot of clinical professionals, as well as about 100 physicians and nurse practitioners. So we have a pretty big breadth. I was just looking at some statistics. We cover 7 counties, 70-mile radius, and really serve both family medicine and specialty services across those 7 county regions that we serve.
Wow, that's amazing. So also something that's very exciting. So June 19th, we had our groundbreaking for the new surgery center.
Yes.
$40 million expansion and state of the art. Just let's if you wouldn't mind sharing just the impact and just all about that project with our listeners.
I would love to. So super exciting event to be able to break ground for this surgery center. It's been a long time coming.
Yeah.
What were you doing in 1974? 1979.
Well, I wasn't born until 83.
Yeah, so you weren't even born. There was many people here. Do you know how much eggs cost in 1979?
No.
85 cents.
What?
We've come a long way from 85 cents.
Goodness.
So our surgery, our current inpatient surgery was opened in 1979.
Oh my
and really
gosh.
we've not had any improvements there. And so, we've been looking at this project, like, what do we do? And, if you've built a house or anything, if you change one thing, you have to come up to code in all of the things.
Oh my.
And so to do that in surgery, it just wasn't financially feasible just to do a remodel.
Yeah.
Because things like HVAC, which is the heating and cooling, temperature control, all of those things. Another fun fact, when it was built in 1979, it had 14 electrical outlets. Today, the standard in surgery is 36 electrical outlets. Like, just interesting things like that we've come to learn as we're putting together this new surgery development. And so, it's really meant to bring state-of-the-art services to our community. That's the whole purpose for this investment. And as all of you know, retaining and recruiting physicians to Fort Dodge can be really, really difficult. And we're improving the quality of life issues by all of the things that you're doing in the Growth Alliance. But so really having state-of-the-art surgery services for them to come to. Since we announced the project, we've already been able to recruit 2 new surgeons to our community.
Yeah,
So
that's awesome.
Yeah,
Congrats.
That's really awesome. So a general surgeon and another orthopedic surgeon. So those kinds of things matter when it comes to recruitment and retention of physicians. So, and then of course we want to bring our staff together as one team. It'll just make it better for them. Seamless for the patients. So just good for everybody. Good
all
for everybody.
Around. Mm-hmm. I know that, we recently had a personal experience. I had a little guy that had his tonsils out and amazing team. I feel like the care there, it's like we have exceptional people doing quality care. And so it's like you want to look around and be like, oh, we are in state-of-the-art place where our equipment is amazing too. And so matching that, and it's like you can't find a better place for healthcare, you know?
Exactly.
And that's really cool that you guys also are just putting that investment and how much care and time and energy into this. And I could imagine that probably a lot of these physicians and these surgical professionals, they're probably training in high-tech areas, and then they if we want them to come, it's probably that much harder if it's not matching their education side of it, right?
Exactly. Just a great example of that, Astra, is we just was approved by the Certificate of Need of the state of Iowa to approve a Da Vinci robot.
What's a Da Vinci robot?
Yes,
that sounds fancy.
I know, right?
Fancy.
So all physicians today are trained on the Da Vinci robot. So it's basically robotic assisted surgery.
Okay.
So our physicians are actually moving the hands of the robot. So they're using their own education and training to get in to fix whatever problem the patient might have. It's not for all surgeries, but it's for some. And what's really cool about it is you just need very little entrance points. So the recovery is faster, the damage to the tissue is less. It's just a great opportunity recovery for a patient. And so we're really excited to add that to our suite of surgical advancements along with the new facilities. So there's many cool things happening in surgery. And if you don't know it, we have amazing physicians doing surgery here at UnityPoint Health Fort Dodge. So we're really blessed in that category, and even more coming on board. So
it's really a full service. I mean, we are a more rural area, but we have full service, things that you can get in Des Moines and things that you can get that you don't have to drive, and you can trust that those are the best place for care. So I do think that there's a lot of, with Trinity Heart, and we've got, all the babies that are born, there's so many things just full service that we can have right here at home.
exactly.
And I appreciate that. So
Yeah. And like you said, I mean, we are a regional referral center.
Yeah.
So as I said, 7 counties around here with family practice and specialties helping all of those counties. Our focus is on our rural community. That's what we are, and that's what we serve. And so we are really focused on keeping exceptional healthcare right here in Fort Dodge.
Right here at home. One thing, Leah, thank you so much for serving on the Greater Fort Dodge Growth Alliance board. And as an executive officer, you get sort of this backstage pass to a lot of, you see the nuts and bolts of our economic development efforts with economic and community development with attraction and retention and expansion and housing and workforce. And that's such a big puzzle piece, but healthcare is a very important piece of that puzzle. Do you want to explain some of that for our listeners?
I will. You know, strong hospitals are the backbone of a healthy, thriving community.
Absolutely.
And so it's really important that we ensure the strength and stability for the future. And so that's why we are making the investments we are today, so that we can continue to be that a part of the economic engine in our community. And, you know, we don't want to just do it because of that. We're doing that because we want to serve. We want
people
to serve
deserve
everybody.
the best.
They do.
Yeah.
And we want to serve all in our community, not just one group of people, but we want to serve all the needs. Now, we realize we can't do everything, but we want to do the most good for the most people here in Webster County and Fort Dodge and beyond, really.
And I think that we're definitely doing that. And with this new expansion, we're on the right track to do that at an even greater capacity. So
absolutely.
It's exciting times
It
right
is.
here.
Yes, it really is. And just such an important, such important work.
Yeah.
All of us doing our part to move our community forward.
It's all a piece of the puzzle.
Yes.
I love that. And, you know, I think too, whenever we're attracting the next big company, they have to attract workers, and workers want to be in places where they can get quality health care.
Absolutely.
So it all plays together. Hey guys, thanks so much for listening to the Alliance Connection podcast. Stick around as we hear a quick word from our sponsor.
Propel your career forward with a Master of Arts in Organizational Leadership from BVU. No matter what industry you currently work in or where you aspire to be, this master's degree will prepare you to be an agile leader.
I liked the flexibility of it being online and asynchronous, so I could study when I needed to as a working adult and parent and husband. The fact that you could take one class at a time, that was really enticing to me.
UniVista University's graduate program is created for working professionals. It's 100% online. There's 7.5-week terms. 1 course per term, making it easy to do alongside your career. Classes start August 25th. Contact grad@bvu.edu or call 712-749-1000 to learn more.
So obviously healthcare is always evolving.
Yes.
What are some of the biggest shifts you're seeing in healthcare regionally?
Yeah, that's a great question. So you're right. It's moving so fast. Lots of changes happening in healthcare across the country. And so it's no different here in Fort Dodge than what we're experiencing all over the United States. And so one of the biggest things is telemedicine. So we're able to bring doctors from across the country to serve patients right here in Fort Dodge. We do this through telemedicine. And with the physician shortage across the country, it's necessary for us to get the highest quality physician. It's not just now who can move and is willing to move to Fort Dodge. It's we'll work with them. We have doctors in New York. We have doctors in North Carolina. We have doctors at Iowa City that serve our community now today because of the ability to do telemedicine. And so that's not happening just in Fort Dodge, but it has to happen across the country due to the shortages of physicians.
Yeah, absolutely.
So
I had an experience with that at UnityPoint. As we all know, mental health care is kind of hard to get into.
Yes.
And so I was surprised at how quickly I was able to get an appointment just to be for my med check.
Yeah.
And it was a virtual one. And I didn't really know that it was going to be one. But when I got to the room, it felt like she was sitting in the room with me.
Yes.
And
awesome.
I mean, anywhere else, that would have taken like 3 months to get into at
There's
least.
such a wait list on certain things. Yeah.
Right. Yeah. So
great.
You guys are doing awesome.
Yeah. And, some of our mental health physicians, one is located in Texas.
Oh, wow.
And so she has a large family that she can't move, but she has a passion for caring for mental health, especially in rural areas where there is this shortage, where access is an issue. And so we are backfilling all of those gaps with the use of telemedicine. And it's like we're sitting in the room today.
Yeah.
Except they're on a TV screen, but they're live talking to you.
Yeah.
We have physicians that can check your heart. They can look just really specifically with a zoom lens on their camera to see if you have like a wound or a skin issue that we need to assess.
Wow.
So all of those things technology has advanced so far in this space that it feels like a physician's just right there with you.
Absolutely.
So,
that's awesome. And Leah, I know you're such a dynamic leader, and we're so lucky to have you here in Fort Dodge and Webster County and serving the 7 counties around. But can you tell us, I know that you also are bringing some of these rural initiatives and issues to the national table. Can you kind of share about your work on that?
Absolutely. So I serve at the Iowa Hospital Association. I'm on the board of the Iowa Hospital Association, which that drives a lot of the policy in the state of Iowa.
Okay.
Of course, Ann Meyer is a wonderful partner to us at the state level with her experience in healthcare and her experience as a nurse. So Ann has been a great advocate for Iowa healthcare. And so I do serve on the American Hospital Association, the Region 6 board. Okay. So that's a policy advisory board where we are bringing forward issues that we're experiencing like right here in Fort Dodge.
Yeah.
And I'm able to bring those stories forward to the federal level.
Wow.
And so I can share about the use of telemedicine. And honestly, when Senator Grassley was here, we were able to have him experience a fake telemedicine visit, but with a real physician on the other end. And so I think with those kinds of exposures, people understand the importance of things like the payment model for telemedicine. We had to work really hard to be able to have payment structures built for telemedicine.
Right.
So things like that are important, but also just access issues, reimbursement issues. I'm able to share the challenges. We have a very large Medicare and Medicaid population here in Fort Dodge. And so I'm able to share how that looks from a reimbursement for our hospital, maybe compared to someone in an urban area that has more insurance-based payers. So those kinds of things, it's a blessing to be able to share the stories right here at Fort Dodge on a national level and really be able to advocate then for policy that supports the changes that we need.
Right. And that just makes a greater impact. So thank you for your work on that. That's amazing.
I love being able to do it, and I'm honored to be able to represent our community in that way.
What excites you most about the future of UnityPoint here in Fort Dodge?
Yes. So I have to start by saying, gosh, we have a wonderful foundation that was built on physicians like Marshall Hunting, Dr. Barry, leaders like Tom Tibbetts, Sue Thompson. And so our foundation is very strong. And so with that, now we're able to build and make those changes that we need to be able to continue to deliver care in a new environment. Yeah. And so I'm excited to be able to have wonderful staff that help us. I'm super excited about the cancer work that we're doing. Of course, we have doctors like Dr. Tofflin providing oncology services. I'm excited about, of course, our Trinity Heart Center.
Yes, that's
the work
exciting.
that's happening there, the care we're able to provide our community through the Trinity Heart Center, which has just grown like gangbusters since the day we opened. We're adding more doctors and nurse practitioners regularly to be able to meet the need of the community. And we're able to do that because it's part of UnityPoint Health. And so we're willing to make that investment. I'm also really excited, of course, with our new surgery renovation and addition.
Oh, yeah.
It is a game changer. It's a strategic move, but just really necessary move for us to be able to continue to to deliver great care for our community. So.
And really be a regional leader here.
Exactly.
That's so exciting.
That's right.
That's awesome.
Is there anything that you would want to share with our community from UnityPoint? I mean, you are the leader of UnityPoint here. Just with there's so many patients that might be listening. Anything that you want to share with them?
Yes. Thank you for being, allowing us to be your trusted health partner. That means more than you know. That is the most important piece of our business, is the trusting relationship that we have between our patients, our doctors, our leadership. So thank you first for allowing us to do that. And for those of you that have had great experiences at UnityPoint Health, tell your friends.
Yeah.
And if there's someone out there that hasn't had a great experience, call me. We are a listening organization. That's one thing that I have taken full accountability for, is that we will listen to you. And when we hear concerns, we make changes based on the feedback, whether it's employees to make it a better place for them to work. Yep. By the way, being listed as Becker's top workplaces.
Yes, congratulations.
Yeah, so that's a
awesome.
Great celebration. But why do we get that? Because we listen to what our employees need, and then we're making improvements based on that. And so same with patients. We want to listen to where we have opportunities to do better, and we want to make those needed improvements. And I would say we've made a lot of progress over the last 10 years.
Well, and I feel like you offer a lot of avenues for feedback for patient care, whether it's a survey. I feel like whenever I go in, I get a little card, and it's like there's ways that you can do that. And again, making sure that we serve everybody and serve them well is, I know, such an important piece. And that's exciting to see all the new changes happening with the surgery center. And I'm just so excited for our community, because it's part of it, making it a better place to be.
It is. And I know change is hard for some people. So I'm always very conscientious about that. So we really think hard about what we need to do next before we just do something. And so that is really important to know that change is hard. So we try to keep it as, just to the necessary changes, to stay up with the times in healthcare and be able to deliver exceptional service to our community. That's our goal. That's my goal. And that's awesome. We also have a patient advocate. So if you need help navigating healthcare, the healthcare journey, you have access to a patient advocate that's here in our community. Call us and we can get you connected in that way. So.
Nice. I think there's a lot of things that people just don't know.
Absolutely.
That you have out there as a resource.
Yeah. Absolutely.
That's awesome. Any other things that you'd like to state?
No, thank you. Thank you for allowing me to be here. What a pleasure to meet with the two of you. I just have to say, being part of the Growth Alliance board, and it's been such a joy to watch all of the awesome things happening right here in Fort Dodge, the relationships that Astra you've brought to the table and continue to build in our community. I just think this community is better because you're here. So thank you for being here. And Katie, I know you're new here too.
I'm about 4 months in.
4 months, Katie. All right.
I'm just making things look pretty.
Yes. Well,
that
you
matters.
do way more than that. But, pretty's good too.
That matters. We like pretty.
So, but thank you for all the work you're doing at the Growth Alliance, because you do make this a great place to live.
Well, thank you so much for that. I greatly appreciate it.
Yes.
And without further ado, also make sure that you like, subscribe, share this episode and many others with all of your friends and family, because this is amazing to get the word out. And thanks to Becker.
Yeah. Huge thank you to Becker Florist. We've got another beautiful floral arrangement with us today.
Gorgeous.
You can just smell it from here.
It's gorgeous.
I don't know how they make, do they spray stuff on them to make them smell better?
I don't know.
They smell so good every time.
I know. And just so gorgeous.
Yes. Yeah. It's a beautiful arrangement. The colors, it just makes me feel happy looking at it.
Yes.
So I should go to Becker's and buy some flowers.
I think you should see their selection. Their selection is phenomenal.
Awesome.
It really is.
Yes.
I love that.
They also did our flowers for our groundbreaking.
Oh,
so,
nice.
They did a great job. So.
That's awesome.
That's awesome. Well, thank you so much for tuning in. That tells me that you care about your community and you want to know what's going on. So thank you for that as always, and have a great day. Every connection strengthens our community, and every conversation sparks new opportunities. Thank you so much for tuning in to the Alliance Connection.
Follow the Greater Fort Dodge Growth Alliance online and on social media. Be sure to subscribe so you never miss an episode.
I'm Astra.
I'm Katie.
And we'll see you next time.
This podcast is produced by Spin Market and Digital. Located in Fort Dodge, Iowa, Spin Market's highly skilled team can help you increase your market by updating your website, improving SEO, designing advertisements, and producing podcasts that will grab the attention of your market. Contact Spin Market today for all your digital marketing needs at digitalagent@spinmarket.com or call us at 515-302-8026. And to learn more, visit our website at www.spinmarket.com. That's digitalagent@spinmarket.com or 515-302-8026. Or visit our website at www.spinmarket.com.